the notice. Oh, there it is. Okay. Welcome back. This is a hearing regarding Connecticut Children's Medical Center's application to terminate pediatric inpatient services at the St. Mary's Hospital and relocate them to Hartford. It is docket number 26-32825-COM. Earlier, we completed the technical portion of today's hearing. We got through the applicant's presentation and DPH's questions. We are now ready to turn our focus to the public portion of today's hearing. Afterwards, we will do a discussion of late files that we want from the CCMC, and then we will close things out. Does that sound good to you, Attorney Jensen?
That's great. Thank you.
Okay, so we do, I believe, have one sign up for public comment. Sign up for public comment was from 9:30 until now. It was in the Teams Q&A section. The individual that we have with us is Chelsea Shaban.
Yes, Shaban.
Spelled Shaban. So we typically will limit public commenters to 3 minutes, Ms. Shaban. So if you can just try to hold yourself to that, we would appreciate it. And whenever you're ready, you can move forward.
Thank you. Good morning. Can you hear me?
Yes.
Hi, I'm Chelsea Shaban. I am a nurse practitioner in the, Waterbury community, and I am a mom of two. I do not deal with the pediatric population. I deal with adults, but I just wanted to come and share a comment I have. My daughter is 3. She was diagnosed with pneumonia about 2 weeks ago. So last Tuesday, we were treating her. She went to St. Mary's Emergency Department, where her care was fantastic. Her pediatrician sent her there, actually, to St. Mary's. They decided to discharge her home, and she was doing well with the antibiotics at home. However, unfortunately, last Tuesday night, her breathing got pretty bad, and I had to bring her back to the emergency room. Now, being a nurse practitioner in the Waterbury area, I knew that I wasn't going to make it to Hartford. I mean, her breathing was not stable enough to drive the 40 minutes to Hartford from my home in Middlebury. We got her to St. Mary's. She got right back right away. They put her on oxygen. They did some treatments. They decided that she needed to go to CCMC in Hartford because in the city of Waterbury, there is no public pediatric inpatient unit. So she had to go by ambulance. Unfortunately, CCMC didn't know if she would be an appropriate admission or if they could send her home. So this prompted us to pay a copay at St. Mary's ED and CCMC's ED, where then she got admitted for the night. She was on oxygen. The care we received at St. Mary's and CCMC was absolutely wonderful. I mean, I cannot have asked for anyone else to take care of my baby. However, I will say that there were a lot of downfalls to this for me as a mom and for my family. And we have a great support system. My parents, my in-laws are very involved. They took my son, who was an infant. He stayed overnight at their house. However, we didn't have a car up there because I had to go by ambulance with my daughter because she was on oxygen. My son is an infant. Like I said, he's nursing. It was a 50-minute drive to get someone to come get his milk, get it back to him. And I just feel like as a mom and as, first and foremost as a mom, this was just something that could have been avoided. She did meet criteria to be admitted to CCMC in Waterbury if they did have the unit open. And I just feel like closing this unit is a disservice to the community because, like I said, I do have a great support system. I have a husband who's involved, her dad's involved. He was able to get to the hospital. But he is a fireman who works 24-hour shifts, had to get someone into the fire department. So I was alone in Hartford for a good 4 hours. Um, and we didn't have any transportation home. We do have another child. For these parents from the city of Waterbury who don't have transportation, who have more than one child, what are they supposed to do? How are they supposed to get to Hartford? What are they supposed to do with their other children? I mean, I feel like this is questions we need to ask. And from a financial standpoint, I could see why, they do want to close the St. Mary's unit, but healthcare is not just about finances, it's also about families. And closing this unit is not doing a service to the city of Waterbury. It's doing a service to CCMC because they're making more money, but for the community of Waterbury, this is not helpful. And that's all I have to say.
Okay. Thank you, Ms.
So,
Shaven. And
thank
thank
you.
you for limiting yourself to about 3 minutes. I appreciate that.
Yeah, thanks.
All right, so we don't have any other public comment sign up at this time. And I don't have any additional questions that I felt haven't already been answered based on the public comment. So I'm going to hang on one moment. It sounds like we actually do have a question based on the public comment. I apologize. So she mentioned the copay component, how St. Mary's charged a copay component, and then CCMC also did a copay or required a copay. Can you explain sort of how that works and whether there is any way in which only one copay could be charged, or is that just a necessity of it being two different facilities?
It's a necessity of two different facilities. Even if our beds were open at Waterbury, she would have had a copay presenting to the St. Mary's Emergency Department. And then if she was admitted at the inpatient unit in Waterbury, there would then be a copay, depending on how her insurance works with Connecticut Children's, because they are two different systems.
Okay.
And for the record, I'd also like to wish best wishes for her daughter's health and continued recovery.
Okay. Ms. Shaven, I did see that you had your hand raised. We don't really allow for engagement back in like any sort of back and forth with the public, because if we were to do that, it could become unwieldy. So if you do have additional concerns, you can submit them as a written public comment afterwards. Again, the email address for that is concomment@ct.gov. And with that, I believe that concludes the public comment portion of today's meeting. I wanted to shift focus now to the late files. So I have written 3 down here. The first one is confirmation of whether or not public notice was provided in January in or about January of 2025 regarding the cessation of services at the St. Mary's unit. The second one is regarding CCMC 0210. The response to issue 4. We would be looking for essentially an extension of that table. So we'd be looking for the monthly data from January 2024 through January of 2025. And then number 3 is pediatric patients utilization. I'm struggling to figure out how to phrase this, so I apologize. And it may be that I just need to like put it in writing, which I will do as a written order tomorrow. But essentially what we're looking for is pediatric patients of St. Mary's PSA, what their utilization is at CCMC Hartford for 1 year prior and 1 year after. And we'd be essentially looking for case count by month and what percentage of the ED capacity was made up of those Waterbury PSA patients. So that was a lot of words. Again, I will put that in writing and it'll make sense at that point. But Attorney Jensen, do you have any questions about any of those?
No, I believe subject to seeing what gets put in writing, but I have an understanding of what you're looking for on each of the late file requests.
Okay. So I believe we are ready then. As I said, I will issue that as an order either today or tomorrow. How long do you think you might need to pull those 3 items together?
So I'm not there to nudge people under the table as to how long they need. Does 2 weeks sound reasonable to you, Bob?
It
In
does.
order to be able to pull that data? Okay. And we'll endeavor to get it to you sooner, but 2 weeks should be plenty of time.
Okay. And if you run into any barriers, just ask for some extra time and we can accommodate that. So we can now turn to any closing statement or argument that you might have. So Attorney Jensen, would you like to make a closing statement?
Yes, and I'll do my best to keep it brief in recognition of everyone's time. But thank you again, Hearing Officer Chuka today for the time today, and to everyone who participated and the witnesses, Dr. Sakharan and Mr. Duncan. It was very helpful to be able to explain the circumstances behind the proposal. The real key issue to me is that this application is responding to what we have seen in terms of the demonstrated need for these services. The utilization data, this is not a blip in the radar where we're seeing something unusual or an outlier. The utilization data has been extremely low for inpatient services, and it's been low for over a decade. There have been trends that have come and gone during that time period, but the utilization data has been really pretty consistent in terms of showing that these beds are just not being used at anywhere close to capacity. In fact, it's less than 20% throughout most of the last decade. You heard from Mr. Duncan and from Dr. Sakharan about efforts that were made, really innovative efforts and creative ideas to try to increase utilization, but it just hasn't been able to sustain itself either financially or to justify the allocation of resources by Connecticut Children's, particularly where there are greater areas of need in other locations. The demographic birth rate data for Waterbury and the Waterbury area doesn't show that is going to change anytime soon. They are on a decline in terms of birth rates, while other areas are increasing. And where we've seen, and what Dr. Sakharan really described in detail, is that the inpatient care for pediatric patients is really shifting to a higher acuity, more complex level of treatment. And that's where having a facility like the main campus at Connecticut Children's provides so much more value in terms of specialists, subspecialists, access to specialized equipment, and expertise. That really, that is what these families are looking for when we're faced with a situation, the incredibly difficult situation of having a child needing to be admitted to the hospital. So just to emphasize, there are no pediatric services that are disappearing or being reduced from Connecticut Children's System. This is a relocation. We are going to, and the organization is committed to ensuring that emergency care, physician services, referral relationships in the Waterbury area remain in place. Connecticut Children's has, throughout the entirety of its existence, demonstrated the importance and its the emphasis in continuing to participate in Medicaid, maintaining financial assistance policies, being able to treat that population and others regardless of their ability to pay. I heard Dr. Sekaran say he rarely even knows what the type of coverage that an individual patient has, because that's just not a criteria that we're typically looking at. Connecticut Children's is a place where all are able to receive the care that they need. We want to ensure that stays that way. And the way that we can continue to provide these services at times involves making some difficult decisions. And I hope it was made clear today that this was a difficult decision. This was not taken lightly. This was not a decision that was a reaction to one particular event. This was a sustained period of, despite significant efforts, of us not being able to show that this was a unit that was going to be utilized at anywhere near the level that warranted sustaining it. The financial evidence supports that. The trends in pediatric care that Dr. Sekaran explained in great detail support that. It's consistent with the statewide health plan goals that have been articulated in the statewide plan. All of these aspects of what responsible stewards of the finite financial resources that are available to provide the highest quality care to the children in Connecticut all support this idea that it's going to be necessary at times to make difficult decisions. This is one of those, but ultimately all the evidence has shown, and I know that the organization believes very strongly that this is the right decision in order to provide the best care, the highest quality care for the children in the state of Connecticut, while ensuring that children from the specific Waterbury area and the greater Waterbury area will continue to have access to these inpatient services and a full range of specialized pediatric resources in Hartford and elsewhere. Based on the statutory CON criteria that I won't go through, but what we've been through many times hearing Officer Chuka, need, quality, access, financial feasibility, efficient use of healthcare resources, all of these aspects of that you, Hearing Officer Chuka, and the Department of Public Health are charged with considering in assessing an application like this, all support the granting of this application. So thank you again for your time.
Thank you, Attorney Johnson, and thank you to everyone for attending today. A reminder again that written public comment can be submitted up to 7 days from now at concomment@ct.gov. This hearing is hereby adjourned, but the record will remain open until closed by DPH after receipt and review of the late files. Thank you and have a good day.
Thank you all.